Access to populations in the Congo is extremely hard. You might be able to take a 3-hour flight from Kinshasa to a big town in the north, but then in order to travel from that town to an epicenter where the outbreak is really taking hold, it can take you 4 days to travel 120 kilometers when the roads are bad and there's rain everywhere. The health zone that we were working with had a population of about 300,000 people. The roads and the accessibility was such that, you know, you're on a dirt path of 200 kilometers with villages more or less dotted all the way along. You have to take motorbikes with sort of medical donation kits on the back. You would go in teams of 2 or 3, say twice a week or once a week, go and meet all of the people in all of the villages, speak to the local nurses who are Ministry of Health officials working in those regions, and tell them that MSF is doing medical care for severe complications related to measles and, if necessary, malaria or malnutrition. Communities were just like, wow, this is, you know, first time in a long time that we've seen anyone coming to do this kind of real, like, on the ground, community level work where, you know, we'd go from village to village with health promoters, with nurses, trying to stock up local health centres with medications relevant to our intervention that they needed, doing lots of health promotion, doing vaccination campaigns, doing malnutrition care. There was a lady called Dr. Mami who was there. She was a Congolese MSF doctor working in the inpatient department, and she had just a brilliant spirit and kept all the parents and all the kids more or less happy, I think you could say, in spite of the difficult conditions. The POOC is the perfect example of a project in MSF that benefits the most from our private funds, because the very sort of spirit of the POOC is to be able to intervene with the shortest possible notice, with the most possible resources if necessary, to have the highest possible impact on saving lives. It was extremely difficult for the people living there, especially when all of the other factors that affect their general level of health are sort of compromised. The whole of the DRC is vulnerable. You know, this is in 2020 in one of the most resource-rich countries on earth. The infrastructure of the whole country is such that it's kind of a permanent emergency. MSF focusing on medical care, I think that we're in a really brilliant position to ensure, at least in the short term, in the immediate emergency capacity, that people don't have to die because we're on the ground there.